Hi, my name is Brittany Brown, and I'm going to talk to you guys about adult daycare. Um, not everyone knows what adult daycare really is. When I think of adult daycare, I think of child daycare. Not many older adults like to admit that they may need help, even if it is from a family member. Most of the time, their family members are working. We all know how that is. You work Monday through Friday, some work weekends even. Can sometimes make them feel like they're losing their dignity and they have to swallow their pride to admit that they need help. So an adult daycare center can actually be the perfect alternative for a person who depends on someone such as a family caregiver to help them throughout the day. Continuing to live in their homes and use this adult daycare center is an opportunity to help maintain their mental and physical health even longer. No one likes to picture themselves losing the ability to do things for themselves. So, development of these programs were actually slow until the cost of institutionalization, inhumanity of many nursing homes, and the burden placed on family caregivers was recognized. I will be discussing what an adult daycare is and who it is for, as well as what services are provided and by who, along with the average cost and how it is funded. So what is adult daycare? The primary intent of adult daycare is to prevent the premature and inappropriate institutionalization of older adults by providing socialization, health care, and or both. There are three different types of adult daycares. Social adult daycare, which provides social activities, meals, recreation, and some health-related services. There is adult day health care, which offers intensive health, therapeutic, and social services for individuals with serious medical conditions and those at risk of requiring nursing home care. And then we have Alzheimer's and dementia daycare, which is basically the same thing. They have an additional focus to prevent wandering, injury, and even behavioral challenges. So this helps older adults. Main age is normally 65 years and older. Veterans, older persons with mental health problems, the blind, Alzheimer's disease or dementia patients, as well as cerebral palsy. And what services are provided? Mostly they get assistance with eating, taking medication, toileting, and or walking. They get counseling, educational programs or mental stimulation, exercise. They have health monitoring, podiatry care, preparation of meals and snacks. They're usually provided at least one meal a day. Social activities, even therapies, different occupational, physical, or speech therapies. Transportation services can be included. The social activities are crafts, cooking, exercise, field trips, games, gardening, holiday parties. They even have music and pet therapy, as well as some have relaxation techniques. And how it is funded. The cost is usually anywhere between $25 to $100 per day. They do have half-day and hourly options as well. There is also a sliding scale, which is basically where they will take an individual's income into consideration and their ability to pay when they actually determine the daily fee. Insurance does help cover adult daycares, certain insurances. Unfortunately, Medicare A and B do not. There's long-term care insurance, life settlements and life insurance policies, state PACE programs, daycare scholarships, advantage plans, veterans benefits, reverse mortgages, and even Medicaid. Medicaid pays for this service mainly because it can prevent full-time nursing home care, which can actually cost a lot more in the long run. So when considering adult daycare, there are a few important factors. You want to think of the level of care and special needs requirements, location and transportation. It would be ideal to have a location that is close to your home, as well as a facility who provides transportation. It makes it easier on you. Licensing, you want to make sure that they are licensed, as well as hours and cost. Obviously, you want the best care for the lowest cost. And hours, if you do have to take your loved one to this facility, you want the hours to work with your work schedule. Staff credentials and ratios. This can be very important to make sure that they are getting the supervision that they need and the care that they need. You don't want one caregiver to 18 adults. So you want to take that into consideration. Some do have nurses on staff, as well as social workers, activity directors. So the more people, the better. I want to just talk to you guys a little bit about my personal experience that I had. My friend who I used to work with is actually a manager now at an adult daycare center. So I was able to speak to her and the owner of Alternative Solutions. It's here in Akron. They are actually considered a social adult daycare center. The owner is actually a nurse practitioner, so she is there most of the time. Primary population is seniors, usually 65 and older. Age requirements, 18 and older. Their hours of operation are Monday through Friday, 8 to 5. Some don't stay the full day. Some come at 9 and leave at 3:30, which is fine. The activities provided there are socialization, current events, games, crafts, movies. They have outings, and they also provide lunch and 2 snacks. The transportation is included. It's either by the company van or they are subcontracted through the Metro Scat. The cost is either $10 per hour or $50 per day. The funding that they have available is for private pay, Passport, Care Coordination, United Healthcare, CareSource, MyCare Ohio, as well as long-term care insurance. And when I walked in there, it felt like home. They were laughing and playing cards, dancing to music. I walked into the smell of freshly baked cookies, so that was pretty awesome. Half of them were watching a movie. They have a shower there if anyone needs that. So it was pretty awesome. I definitely think that if the time comes, I would consider that for my loved one. Some fun facts. The U.S. Department of Health and Human Services reported at least 70% of people over 65 will require some long-term care services at some point. In 1978, only 300 adult daycare centers existed nationwide, but according to the National Adult Day Services Association, by 2010, there were 4,000 in operation, 80% of which were operated by not-for-profit organizations. The National Adult Day Services Association also identified 5,685 programs in the U.S. in 2014. So today we learned what adult daycare is and who it provides services for, what services are provided and who provides those services, how much it costs on average, and what types of funding are available. So if the time ever comes, you may want to ask yourself a few questions. Is your loved one incontinent? Do they have any behavioral problems? Do they wander? Do they have special dietary requirements? Or do they just need some socialization when you're not available during the day? If any of these do apply to you, adult daycare may be a perfect alternative. Like I said, I could definitely see myself taking a loved one there. And thank you guys so much for listening. Have a good day.